go find somebody to do a resistance training program, or go do one on your own. We're going to start off with, does resistance training improve pain intensity, quality of life, and disability in people with chronic, non-specific low back pain? I like this one. It's a systematic review, so it's really looking back at a bunch of different studies to get a big picture, and it's a high level quality of evidence. And you can probably already guess what we found, and that is it does. If we look at the 10 randomized controlled trials that it included, it showed significant improvements in pain intensity, quality of life, and disability, favoring resistance training. This one even says that the certainty of evidence was rated as moderate. So in a lot of studies, you'll find that they'll break them down into high bias, low bias, low evidence, strong evidence. This one has a lot backing it, saying, hey, the certainty is actually at least moderate. We have systematic review showing that resistance training. So actually, I'll just jump to the conclusion because it says it. Resistance training programs effectively reduce pain intensity and disability in patients with non-specific chronic low back pain. And the moderate certainty of evidence suggests that resistance training can be recommended as a general intervention for non-specific chronic low back pain. It's something we see in the office. It's something we were trained on in school. It's something we see in continuing ed courses. It's something that pops up all over the place in various research articles that we see. So this one isn't telling us anything new, but it is summarizing it because it is a systematic review with pretty good evidence to back it up that, you know what, if you've got back pain that there's no real rhyme or reason or major thing on why it's there, like, my back's been hurting for a couple of months, maybe even a couple of years, anything in there, and there's nothing like surgical, like, don't get me wrong, I'd exercise anybody with any of the conditions that I'm actually about to list, but as a carte blanche, like, I don't have to examine you, I can just tell you exactly what to do. It's like, hey, you have random low back pain that you've had for years, there's nothing major to it, there's no red flags, go find somebody to do a resistance training program, or go do one on your own. Like, if you want to get better, this is one of the best things that we can recommend for you. And if you happen to have other conditions where you kind of want to put on the brakes a little bit, it's like, hey, I have surgical hardware.